Hello, my name is Hannah Boyinger, and this is for my video assignment due on October 25th. I'm going to be giving 5 different medications to my patient today, which is going to be my husband, and we will go ahead and get started. Hello, my name is Hannah, and I'm going to be your nurse today. How are you doing?
I'm fine.
Good. Could you please state your name and date of birth for me?
Johnson, January 1st, 1990.
All right. Thank you so much, Mr. Johnson. So the first thing I'm going to do is go ahead and provide some privacy. And I'm going to wash my hands. And so I don't have an actual sink right near me, but I would go ahead and wash my hands and go ahead and take care of the hand hygiene. Let's take a look here. So those 5 medications that I'm going to be giving you, are you able to swallow your medications, Mr. Johnson?
Yes.
You are. Okay. And how many pills can you usually take at one time?
5.
Okay, you can take all 5. All right. And do you prefer water or applesauce to take with your medications?
Apple juice.
Okay. Well, unfortunately, we don't have apple juice, but I will give you the drink that we have here at the bedside. So, if we were in the hospital, I would give him orange juice, or apple juice. So, do you have any allergies?
No.
You don't have any allergies. All right. So, if I had a normal hospital bed, I would raise the head of the bed up. But he is already setting up at a 90-degree angle, which is appropriate to provide med pass. All right. So the medications that I'm going to be giving you today, they're going to help with your pain, blood pressure, diabetes, and potential infection. Okay.
Okay.
All right. And you're okay with taking all of those today?
Yep.
Okay. Wonderful. So at this point, I would have already gone to the Pyxis, and I would have already looked at my prescribed medications, pulled my medications out of the Pyxis, confirmed that the medications were appropriate to what the provider recommended for the right patient, the right medication, the right dose, the right time, the right route, and then of course I will document at the end. But I've already checked that with the Pyxis, and I'm bringing his medications to the room. I've done my second check for those 6 rights again for all 5 medications, and now I'm coming into the room and providing him with that medication at the bedside. So the third check is going to be done. Check your wristlet again here, your bracelet. State your name and date of birth again for me.
Paul Johnson, January 1st, 1990.
All right. Thank you, Mr. Johnson. All right. So now that I've done the 3 different checks to make sure that MedPass is ready to go, I've donned gloves after washing my hands, and I'm going to prepare the 5 medications for him that he said that he can take all at once. So the 5 medications that I'm going to be giving my patient today are oxycodone, acetaminophen, Tylenol, amoxicillin, as well as metformin and lisinopril. So, like I said, Mr. Johnson, I'm giving you these medications for your pain, blood pressure, diabetes, and potential infection. So the first medication, I'm gonna pretend to put it in here. The first medication is, like I said, oxycodone or Percocet. So the brand name is Oxycontin or Percocet, and it is an opioid pain reliever that helps reduce pain. I'll be checking in to make sure that you're not feeling any drowsy or having any trouble breathing, okay? All right, so the second medication is going to be Tylenol. And so for the Tylenol, the name of it is acetaminophen. It's also known as Tylenol. It reduces pain and fever, and I'm going to monitor your liver function to make sure everything stays within a safe range, okay? All right, so the third one is going to be amoxicillin. And for the amoxicillin, it's an antibiotic to help fight off infection. I'll monitor for any allergic reactions or signs of stomach issues such as diarrhea, okay? And now the fourth medication is going to be metformin. So it's also known as a glucophage. It's used to help control your blood sugar for diabetes. It works by helping your blood works by helping your body respond better to insulin and reduces the amount of sugar produced by your liver. I'm going to be checking your blood sugar levels throughout the day to make sure this medication is working properly. Please let me know if you start feeling weak, dizzy, or have any trouble with nausea or stomach upset, and because sometimes those things can be side effects, and I will be coming back in about an hour to see how you're doing with that as well. All right, so the fifth medication that I'm going to be giving you is lisinopril. So the lisinopril is used to lower your blood pressure, and I'm going to be monitoring your blood pressure and watching for dizziness or any other side effects, okay? All right. Something else, Mr. Johnson, I just wanted to let you know was the class of the medications that we gave you. So just wanted to mention those to you here. So the class of the medications for the first one that we gave you for the oxycodone, that is an opioid analgesic. And so we gave him the oxycodone or Percocet. And like I said, opioid analgesic is the class. The second one for acetaminophen or Tylenol. That classification is an analgesic or antipyretic. And then the third class for the third medication was, we gave you amoxicillin, which is an antibiotic. And that class is going to be an antibiotic slash penicillin class. And then metformin, glucophage, that classification is an anti-diabetic agent. And the sixth one that we gave you, lisinopril, our Zestril, is in the ACE inhibitor classification. So, any questions with that? Great. All right, Mr. Johnson, now that I've given you all the information about your medications, the class that they're in, the type of medication, the brand and the generic name, any potential side effects and things of that nature. I've got your water here for you, and I've got your medications in here. We're going to pretend that those are in there. And you said that you can take them all 5 at once. Good. Go ahead and swallow those. Perfect. Thank you. All right. And you're able to swallow all those medications? Okay. Perfect. So I'm going to leave you sitting up for a little while, okay? All right. So while I leave him sitting up, I'm going to just tell the patient that I'm going to be back in about 30 minutes to check on pain level, blood pressure, and to see how he's feeling overall. Check and make sure that there's no potential side effects that he's experiencing. So then I'm going to document everything in his chart and note that I've recorded all the medications. And also let me know if you're feeling dizzy or have any trouble breathing, and I will be back in to check on you soon. All right, so then at this point, I will document, and I'll also give him his call bell to make sure that it is within reach. I will take my gloves off, wash my hands, and then, like I said, I'll document those 5 medications. So the first couple times that we did the video, there was definitely some funny bloopers, so I'm going to cut those in at the end. My name is Hannah. I'm going to be nurse. I'm going to be your nurse today. So, after we stopped giggling and Jalen, my husband, Paul Johnson, could not stop laughing, we were finally able to do the assignment. But thank you for watching and taking the time, and hopefully I was able to cover all the bases for the 5 medications for MedPass for the video assignment. So thank you.